We're continuing to follow the latest on coronavirus in our state and what it means for our community. Here's a look at the latest numbers from Montana's coronavirus task force. This is where we're getting our information, along with from county health leaders. These numbers updated at 4:30 this afternoon. Montana now has 262 confirmed cases. There are 11 cases in Cascade County, and new tonight in our area, 1 case in Glacier County. More than 6,000 tests have now been completed. According to a Friday afternoon update from the Montana Department of Public Health and Human Services, there are now 12 confirmed cases of COVID-19 in Toole County. In addition, 3 of Montana's 5 COVID-19 deaths have been Toole County residents. TCHD Director Blair Tomczyk said in a news release today, quote, "We're working closely with all healthcare entities in Toole County to address these ongoing cases as they are related to our current investigations," end quote. 8 of the 12 cases are people under the age of 60. With the jumping cases today in Toole County, the health department and the Marias Medical Center have decided to take some further steps in response to the outbreak. Leaders have created a joint information center. This will help provide a central point of contact for information countywide. The center will be up and running on Monday. Shelby's mayor has said that a unified voice is key when it comes to communication with the public and addressing rumors during a pandemic. We'll be sure to keep you posted on that situation in Toole County. And we've also had a lot of questions from viewers asking why we don't release where in each county the cases are from. This isn't up to us. It's decided by the health department. In a virtual Facebook Q&A session, the Cascade City County Health Department said the reason they aren't disclosing more details about the cases, including the cities which they originate, is to protect the patient's right to privacy. They say, quote, we don't tell you the city that they live in because in Montana we have a lot of smaller cities. If we tell you there's a case in a certain city, then it's possible the community could identify the patient, end quote. Governor Steve Bullock says closures linked to COVID-19 are likely to remain in place for at least several more weeks. MTN's Jonathan Berrien has more on what the governor said earlier today in Helena.
On Friday, Governor Steve Bullock said it's as important as ever for Montanans to keep following the state's stay-at-home order.
I can't stress enough that every step that Montanans take now and in the following weeks will make all the difference in managing through this health crisis.
Bullock said about 10% of the people who have tested positive for COVID-19 in Montana so far work in healthcare.
So staying at home also means keeping our heroes on the front line as healthy as possible.
Currently, Governor Bullock's school closure and stay-at-home orders are both set to expire next Friday, April 10th. He said they haven't officially decided to extend them yet, but that people in Montana should expect they will be extended sometime next week.
I'd said to someone, I think like most Montanans, I'm over this. I wish the virus was, and the virus isn't over this.
Bullock also announced several steps aimed at making sure families in need have access to food at this time. He said the state will double its supply of food from the federal government to food banks, pantries, and other providers. They will also allow families receiving SNAP benefits to keep getting them without having to reapply during the emergency. Bullock said the changes will help more than 100,000 Montanans.
No Montanan should have to worry about putting food on the table for themselves and their families, especially during a global pandemic.
In Helena, Jonathan Berrien, MTN News.